So I actually feel like the Scholars Program relates to nursing extremely well. The Canvas topics that we go over have really helped me within my nursing career. Sometimes, like a lot of the topics we cover on Canvas and even with the experiential hours, we don't really hit too heavy on those when you're in nursing school. It's a lot of medications, drugs, diseases, stuff like that. So some of these factors that we've covered, especially things like social determinants of health and teamwork and communication and collaboration with other members of the healthcare team, they've really given me like a leverage in what I do, because sometimes those factors actually impact your patients more than their actual disease.
The Scholars Program pairs really well with medical school. Um, it's it's good because in medical school they just teach us about diseases and how to treat them and what tests to order and how to read those tests. But the Scholars Program really looks at the other side of medicine, the public health side, how these diseases can affect patients from a mental health standpoint, how they can be impacted by their socioeconomic status. It's just been really good to have these two programs together to get the perspective from both sides to better take care of our patients.
I think it's really important for people who are going into the medical profession to be very aware of a lot of the material that's covered in the scholars program, whether it's quality improvement sort of things or um, more social determinants of healthcare geared material. I think that especially in today's society, when we're working as a part of a massive healthcare team and coordinating care, as physicians, we're expected to lead a lot of that coordination. And with that leadership comes the, I guess, necessity to be aware of all of the material in the scholars program, at least at a surface level, and then develop further understanding kind of as your career sees necessary. So I think that in that way, there's not a lot in the scholars program that doesn't relate to the practice of medicine and what my future is going to look like.
I was drawn to the program originally because I saw that we would have the opportunity to network with other students across the state and students who are in other healthcare fields, since we don't really get the opportunity to do that when you're just with your little cohort of people who are studying the same thing as you. I think this program does a great job interconnecting fields.
I had no clue what AHEC was before they kind of asked me if I'd be interested. So I started learning about it. I'm a kind of person that I like nursing a lot, and that's what I'm doing. But I'm also interested in things that are outside of just direct patient care. So I think AHEC has really given me the opportunity to study and learn about things that aren't necessarily skills or medications, and like that is really interesting to me, and I really like that aspect of the whole program.
The most valuable experience from the Scholars Program is being able to work with a team and collaborating with other professions. So, working in healthcare, especially in a hospital setting, there's always teamwork and collaboration. The program has allowed me to work with people from different areas and different majors of healthcare, so we can come together and work on this project, which is a lot related to healthcare because we're working collaboratively from different areas of healthcare to take care of a patient and get them to their end goal.
I've really enjoyed participating in different reflections and discussions with other healthcare students and hearing from various healthcare professionals throughout the past few years. And I think it's improved my understanding of what different healthcare professionals bring to a team and has sparked some ideas about how I, as a future pharmacist, can contribute to like being part of an interprofessional team.
The most valuable thing I have done so far has been the opportunity to work with interprofessional students and other healthcare providers. So we are kind of taught in silos in our educational system, and we kind of graduate and then begin to work in teams with other healthcare professionals and kind of learn the dynamics of that team. But this kind of brings it into focus sooner in our education, and something is part of our development which I think has been a valuable resource at this time and has kind of provided me with a unique perspective of how I can get involved and collaborate with other professions during my education.
While working with other students, I notice that I'm often focused only on my discipline, only on the treatment part. And this realization has really helped me understand sort of the need to expand on my perspective and really view the patient as a whole. Considering like other factors like psychosocial factors or socioeconomic aspect of the treatment as well, expanding to those can really help me and my colleagues reach our common goal, which is often making sure the patient is taken care of.
It's going to affect pretty much everything that I will do in the future. The coolest thing is that we've been able to have blocks of education, our homework blocks about effective communication, teamwork, leadership skills and styles, and how to make yourself a better and more well-rounded healthcare professional. But then also, learning how to advocate for yourself as a crucial part of that healthcare team, saying, this is my role, this is why it's needed, especially in social work. We help bridge the gap in so many different areas. So learning how to really advocate for myself too, in that sense of saying, I need to be at that table, as does everybody else. Really just working forward to improve healthcare in rural areas. It's really nice.